This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh, where we're going to be discussing peripheral arterial disease, otherwise known as PAD. Now, this is something that many of us may be dealing with and we don't even know it. So we're going to be sitting down with Dr. Gurjeet Kaleka to discuss PAD. Well, thanks for taking some time with us again. Today we're talking about peripheral arterial disease, and of course September is PAD month. So let's start out by talking a little bit about what is PAD.
So peripheral arterial disease is one of the most common disease in North America. In fact, 8 million Americans are affected by a peripheral arterial disease. It is basically the plugging of your arteries with atherosclerotic plaque in your main arterial system, supplying your arms, your legs, and your body. So the heart sends the blood to the aorta and then it goes to the smaller arteries. So fairly common disease is due to various risk factors. It can be caused from obesity, it can be caused from smoking, diabetes, hypertension, and a high cholesterol.
Is there a situation where a lot of us may have PAD and not realize it?
Yes, it's one of the most underdiagnosed and undertreated disease at this time. In fact, there's a recent study out there that majority of the primary care physicians don't even diagnose peripheral arterial disease. Patients may have symptoms that may either correlate with PAD, or they have symptoms that they may attribute to either old age or arthritis or just generalized fatigue.
So in a case like that, and in Wisconsin, and I know I'm guilty, sometimes our diet isn't as good as it should be. That's probably one of the leading causes.
Yes, so again, the biggest risk factor for peripheral arterial disease is actually smoking and diabetes being the top two culprits of the disease. But in addition, hypertension that's uncontrolled, high cholesterol, as well as dietary factors, what we eat and exercise also plays a major role, as well as obesity is also a risk factor for peripheral arterial disease. And there's also association with family history. Now, and also aging population, the higher risk of peripheral arterial disease. So patients above 60 years old have the highest risk of peripheral arterial disease. Now, aging and genetic factors we cannot change, but we can take control of ourselves with having diabetes under control, cholesterol under control, and quitting smoking.
Now, as we just talked about, a lot of times that goes undiagnosed. A lot of us have it, we don't realize it. What are the risks if it's not treated?
So the risk is actually if you are diagnosed with peripheral arterial disease, you have 4 to 5 times risk of getting either a heart attack or getting a stroke. So it's very crucial that when you do get diagnosed with peripheral arterial disease, that it should be not only the medical management of optimizing your medical factors, meaning controlling all the risk factors we talked about, but also to be screened for other diseases like coronary disease and checking for carotid disease, and also treating your peripheral arterial disease.
How does a person get diagnosed with PAD? I would imagine it would lead to you mentioned some pretty serious problems, including stroke, and then it's almost too late. Right. But are there tests or exams that we can have done to see if we have this disease or other diseases?
Yeah, typically the patient would actually complain that their legs or calves hurt when they walk, and when they rest, the pain goes away. That's a sign that they have peripheral arterial disease. Now, sometimes there can be arthritis also causing leg pain, but typically if it goes away while sitting and resting, and when walking you have a leg pain, you most likely have diagnosis of peripheral arterial disease. In advanced stages, people and patients can also start getting pain in the toes and feet while they are sleeping. That meaning that the peripheral arterial disease has advanced. And in severe cases, you can have ulcerations that are non-healing, or if you get wounds on the toes or the feet and legs that are not healing, also tells you that you may have severe peripheral arterial disease. Now, once you see your family practitioner or family physician, if you tell them the symptoms, there should be a simple test where they can check the blood pressure cuff in your arm and in your leg and try to match it. If there is a difference, or what we call an ABI, ankle brachial index, if you have a difference in those two, then you may have peripheral arterial disease. Then that patient needs to be referred to a vascular surgeon for proper evaluation, diagnosis, and treatment.
Well, let's talk a little bit about treatment. If a person does have PAD, what is the line of treatment?
Okay. So the number one I tell all the patients is definitely lifestyle modification is the number one treatment for it. Meaning you need to quit smoking, have your diabetes under control, keep your blood pressure under control, daily exercise regimen, meaning walking 20 to 30 minutes daily. Even if their legs hurt, they need to rest and then walk again. That keeps the circulation going. And also antiplatelet agents like aspirin, cluster control with statins, and even ACE inhibitors for blood pressure control. Those all things do benefit in peripheral arterial disease. If the disease is severe enough that is causing your lifestyle changes, meaning you're restricting you from doing your daily activities, or while you're working is restricting you from your working schedule, then it needs to be further diagnosed. Now again, initially I will start with the basic ankle brachial indexes, which basically means putting a blood pressure on your legs and your arms and checking the difference. And if the disease is moderate to severe, then the next step will be do a groin puncture and then putting some dye in your legs inside the arteries and taking a look where the blockages are. Some of the blockages can be easily treated with ballooning, stenting, or atherectomy. That will relieve your symptoms. Some of the blockages, if severe enough or if cannot be treated with a minimal invasive approach, they can also be treated with open bypass surgeries if needed.
So it sounds like these are things we want to avoid. So if we just make some simple changes in our lifestyle in terms of what we're putting into our body and how we're exercising, we can avoid a little bit of this.
Yeah, you can definitely control and avoid. And what I tell a majority of the patients is, even if they're smokers, if they have diabetes, hypertension, you want to stop the progression of the disease. And by controlling all these risk factors, you can at least modify a control to some extent. So you don't want to progress too far, because if you progress to severe disease, you have the risk of losing the leg, requiring an amputation. But also, again, you have to figure out the other risk factors, which is the risk of stroke, risk of heart attack is also increased with peripheral arterial disease.
Yeah. So it's not too late. Start taking care of yourself now.
Quit smoking now.
Thanks for your time today.
Oh, thank you very much.
If you're dealing with any of the symptoms that Dr. Kaleka just talked about, of course you should get a hold of your primary care provider. If you have other questions about PAD, give us a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.